In 2017, my husband faced a massive health crisis. He had to be transferred via medical jet to Cleveland Clinic to save his life because we didn't have the specialist here who could help him. And now my husband has contracted West Nile virus. And for the last 3 weeks, he's been fighting for his life in ICU, completely paralyzed, helpless, laying there. And the tests that they sent out of his blood work and the spinal tap, those tests couldn't even been run in New Mexico. They were shipped out to Utah, to Washington, to California, to Arizona, and those tests were delayed time and time again. And if we hadn't been here in Albuquerque 3 weeks ago when my husband took a turn for the worse, he would be dead because he wouldn't have been able to get to the hospital in time. When your loved one is laying in a hospital bed, time matters. Care matters. Expertise matters. The litigious culture towards doctors in our state is so toxic that recruitment and retention is next to impossible. I have lost track of the traveling nurses I have spoken to, of the medical professionals that are overworked coming in on their days off. One of them came in after 4 hours of sleep the other day to give my husband dialysis because he needed it so badly, and there was no one else on staff to do it. I've lost track of the doctors who have come up to me and pleaded for help, that they can't continue this way. And they're worried, they're scared, they're watching their colleagues leave every day. I'd like to say to Senator Cervantes, the trial attorney that is the chair of Senate Judiciary, you have a quote. You said that the interstate medical compacts are a threat to New Mexico's sovereignty. Senator, no one is buying that rhetoric any longer. Your words are shallow, they lack compassion, they lack reason, and they lack action. To the Trial Attorney Association of New Mexico, please come to the table. I speak for every New Mexican who cannot find a doctor, who has delayed necessary care over and over again for months, for a year plus, for people in rural counties that are having to drive for hours to find a hospital who can even help them, for women who are driving for hours and planning their pregnancies because their rural hospital can no longer birth their babies. I speak for every single New Mexican, just like my family, my husband, who had to leave the state initially to get care. I speak for every one of you when I say to every legislator in the House and the Senate, it is time that you step forward and you either lead, follow, or get out of our way. Thank you, Mr. Chair.